Hi everyone. We're moving on to lesson 1.2, Nursing and Global Citizenship. In our previous lesson, we discussed what is global health and we compared it to public health, planetary health, international health, and One Health. In this lesson, I want to focus on developing your global perspective and to think about nursing in the 21st century. Our key terms will be globalization, global citizenship, universal health coverage, and sustainable development goals. So globalization is the increasing interconnectedness of the world. And so this increasing interconnectedness around the world provides us with the opportunity, but also the obligation to develop global identities. Use of the internet and social media and the relative ease of international travel enable easy and instantaneous access to face-to-face, voice, video, and photographic connections to almost anywhere in the world. The migration of families and communities to other countries, whether it be voluntary because of escaping political turmoil, reuniting with family, or to strive to improve economic opportunities, or because of more emergent situations such as natural disasters and war, results in the resettlement and assimilation of large numbers of people into new societies and cultures. It's estimated that more than 244 million individuals worldwide emigrated from their home countries in 2015, representing an increase of 71 million annual migrations since 2000. This massive relocation of people has implications for both immigrants, but also the host societies. International business transactions and tourism are yet other opportunities for increased exposure to foreign cultures, languages, health beliefs, and political systems, and this highlights the need for everyone to view themselves as global citizens. So what does global citizen mean, or how is it defined? So this definition looks at global citizen as defined as awareness, caring, and embracing cultural diversity while promoting social justice and sustainability. And that's coupled with a sense of responsibility to act. So we're going to look at all of this. So becoming aware of global trends and issues is the first step in understanding one's position and role within a larger global context. And that's really the basis of this course. So gaining an understanding and appreciation of the interconnectedness of the world, as well as respecting and valuing existing diversity, provides a foundation that enables us to challenge injustice and take action in personally meaningful ways. Social justice is based on the key elements of human rights and equality, and it's a core value in nursing that supports societal efforts to provide equitable treatment and a fair allocation of health resources to all citizens, regardless of where you live. So I want to think about global citizenship and nursing with three domains: caring, embracing diversity and social justice, and responsibility to act. And this will be kind of our mantra for our global health course. So caring, this is not new to us as nurses. So nursing is often referred to as a caring profession and is consistently rated as the most trusted profession. The goals of practice, education, and research in our discipline are to improve health for all individuals who make up our global society, and to embrace the idea that human health, illness, and emotions are a universal phenomena. Nursing is also a global profession. It exists in every society. More than simply providing care, nurses are essential in shaping policy related to the delivery of healthcare and building the health capacity of entire nations. Being a global nurse does not require travel beyond the borders of Canada. Caring for diverse populations in your home community provides the opportunity for greater understanding and leadership that addresses healthcare inequities threatening the health of immigrants and other marginalized populations. Embracing cultural diversity requires open-mindedness, inclusivity, cooperation, and respect for all interprofessional colleagues and recipients of nursing care. Becoming more self-aware and engaging in self-reflection may help identify your personal biases, your values or beliefs that serve as barriers to or facilitators of effective healthcare delivery. Nurse caring can be extended to include expressing desire to learn more about an individual's cultural norms, beliefs, and values. Nurses and other clinicians can use this information to become more cognizant of disparities that affect planning of nursing care, resolving conflict with coworkers, and developing policy to improve the health of individuals at home and abroad. Promoting and sustaining social justice in the context of global health is a tall order, and you might think, where do we start? But coordinated efforts of nurses around the world can influence outcomes of programs and policies addressing the world's health issues. Serving as a guide to direct collective action, it is important for all nurses to become familiar with the United Nations Sustainable Development Goals. The Sustainable Development Goals, created as a follow-up to the Millennium Development Goals, are an intergovernmental set of 17 goals consisting of 169 targets with 304 indicators to measure compliance from countries. These broad, overarching goals were designed to be applicable to all countries, irrespective of a country's socioeconomic status or political structure. And we will speak to these as we move through our course, and during week 8, we will do poster presentations on these these Sustainable Development Goals. So over the next 15 years, the Sustainable Development Goals are intended to stimulate areas in action of critical importance for the health of humanity and our planet. It's more than just a list of healthcare initiatives. The Sustainable Development Goals stress the need for a healthy environment and promotion of well-being in areas such as protecting the planet from degradation, halting climate change, fostering peaceful societies free of fear and violence, establishing global partnerships, boosting the economy and education, and ensuring that all people can fulfill their potential in dignity, equality, and prosperity. Basic human rights, such as access to food and clean water, healthcare, education, a healthy environment, and safety, are universal and should be guaranteed to all people in all nations. Universal access to health care ensures that health services are delivered to all of the world's people without financial risk or hardship. Universal access to health care has 3 dimensions: physical accessibility, financial affordability, and acceptability. I want to speak to acceptability for just a moment. So acceptability is poor when recipients of the care perceive the services to be ineffective, or when social and cultural factors such as language or the age, sex, ethnicity, or religion of the health provider discourages them from seeking services. Services must be physically accessible, financially affordable, and acceptable to patients if universal health coverage is to be attained. And this is not only in developing countries or other places in the world. We see this in our own country, that universal health coverage is not available to everyone. The final piece of the definition of global citizenship is the responsibility to act. So this entails taking responsibility for decisions and actions, including respecting others, obeying rules and laws, and setting a good example to others. Global citizens feel a sense of responsibility to help when the rights of others are violated, no matter where in the world they live, keeping in mind that local action can create global change. In our next lesson, we'll speak to Think Global, Act Local. So what now? And so what? So global citizen transcends the boundaries of all nations and cultures. Events and conditions happening in one part of the world are now shared instantaneously through social media and have profound effects on other parts of the world. The profession of nursing has a rich history of providing service to the global community. We can build on these past experiences by capitalizing on opportunities to move nurses into leadership roles in coordinating global health care. Whether it is extending a welcoming hand to diverse population groups in your home community or venturing out to work in other nations, consider what you can do as a global citizen to promote health worldwide.